Thanks for having me. Today we're going to be talking about sleep and your best performance, the importance of sleep for the young athlete. And it's actually a huge topic and we don't have a lot of time, so I really wanted to highlight a couple things about sleep, but really talk about some of the common types of sleep problems with an eye towards those that might affect our athletes and some strategies to. So when we talk about sleep, we think about what it is and why we need it. And we know what it is. We can take you to the lab, and there's a picture of an EEG here. We can hook you all up and show the exact time that you fall asleep. It's a period of reduced activity. There's usually a typical posturing. So usually your eyes are closed. Usually you're lying down. It's a period of decreased responsiveness that importantly is reversible. But why we need it is still a mystery, despite the fact that we spend about a third of our life sleeping, despite the fact that all animals need to sleep and it puts you in a pretty vulnerable position. We're not entirely sure why we need it. There's a lot of theories out there. We know a lot of what lack of sleep does, but we do know that we need sleep for energy conservation, memory consolidation, mood regulation, learning and problem solving, organizational skills, efficiency, creativity, and growth. And if you ever hear the term sleep on it, there's some truth to that. So we know from musicians, if they've been learning a new piece and struggling with it, hit a wall, if they go to sleep the next morning, oftentimes they're able to play the piece with much more ease. Similarly, if we teach a group of students and we've done this, we've taught them some new concept and we've tested them on it, and then we've had half of them stay awake and the other half taking a nap and retested everybody after that time period, and those that took a nap tended to score better. And part of the theory is that when you sleep, you let go of some of the non-essential information so that what's left over is everything that you need to know. There are a lot of problems that can occur in sleep, and I like to think of them in these three broad categories. So one is sleep quantity, one is sleep quality, and the last being circadian rhythm and sleep timing. And when we talk about sleep quantity or sleep duration, it's not the same for everyone. It's not the same across your lifespan. So most people, if I ask, would say 8 hours is the optimal amount of sleep. In fact, for younger children, including adolescents, 8 hours is not enough. And 8 hours might not even be enough for adults. The amount of sleep that you need is really the amount of sleep that takes you to sort of be restored of your energy and feel well rested. But important when you look at this, when you look at the 13 to 18-year-old, 8 is actually at the lower end of the recommended amount of sleep. 8 to 10 hours is the current recommended amount of sleep for teenagers. And when you think about our teens who are athletes spending sort of above and beyond extra energy, they might need on the longer end of that spectrum to replenish that. And when you're not getting enough sleep, we call that sleep debt. So what sleep debt is the amount of actual sleep you're getting versus the amount of actual sleep that your body needs. And this accumulates with time, and you can see this with the picture on the bottom. If we start restricting people and letting them sleep, say, only 5 hours a night, that first day or two, they may be able to handle some of that acute sleep deprivation. But with time, the longer we go, that sleep debt accumulates and until you are unable to stay awake or function as usual. And this is measurable. We can bring you back to the sleep lab. We can put you in bed. We can say, hey, how long will it take you to fall asleep? And we can measure that. And that's what we call sleepiness. So sleepiness is your body's tendency to fall off to sleep. And it has a lot of adverse effects, which we'll talk about in a second. But really the only way to get rid of sleepiness is to sleep more. Sleep debt can cause a lot of daytime issues with your functioning. It can make you feel sleepy or drowsy. It can affect how quick you are. In school, we see kids coming to school late, affecting their attention, their academic performance, a lot of mood changes, health changes, effects on your cardiovascular system, increased risk of illness and obesity. Your habits and your impulse control can be affected, particularly important in our adolescents and our young adults, where things like use of illicit substances or driving accidents might be a big issue. When we're talking about our athletes, having too much sleep debt can make you more prone to injuries. So one study showed that athletes who spent less than 8 hours a night sleeping were almost twice as likely to have a sports-related injury compared to athletes who spent greater than or equal to 8 hours. Long endurance sports like running and cycling, those athletes were shown to have lower endurance with both acute and chronic sleep deprivation. And we see that there's effects on reaction time and sustained attention, and this is a problem with more sleep deprivation. So one study in Major League Baseball showed that towards the end of the season, when maybe you would expect people, because of all the practice, to be hitting at their best, actually had a deterioration in their plate discipline. So actually their batting skills could be worse with more prolonged sleep deprivation. Similarly, we saw this in tennis players who are sleep deprived, where they had less accuracy in their tennis serves. So throughout this talk, I try to highlight and read some of the things that I felt were things worth thinking about for our athletes who might be at higher risk for some of these sleep-related problems. And when we're talking about sleep duration, our athletes, because of their training schedules, not just the hours they're putting into training, but the hours then that they have to make up for school, socialization, work, family life, and such, can make it so that they have less hours left to sleep. Physical discomfort from sports, so sports-related injury, pain, body aches, overly hydrating during late night sports and then having to be up to go to the bathroom, all these things can sort of affect you sleeping at night. Body temperature is a problem when you have sports too close to bedtime. So normally our body temperature, our core body temperature decreases, and it's a signal to the body that says, hey, it's time to go off to sleep. But if you're exercising within a couple hours before bedtime, it actually increases your body temperature and can make it more difficult to fall off to sleep. And then of course, travel, just the hours and timing of travel can not only chip away at some of the time that you should be sleeping, but can also affect your circadian rhythm, which we'll talk about in a minute. There are a lot of things that can affect your sleep quality, and certainly won't be able to get into all of them, but I wanted to highlight some of the important ones. So insomnia, which refers to the inability to initiate or maintain sleep, can be a problem. And for our athletes who might have a lot of stress or anxiety related to their athletic performance or upcoming competitions, we can see a tendency towards insomnia. Sleep disorder breathing, or what people commonly refer to as obstructive sleep apnea, is a disorder of breathing where there's prolonged upper airway obstruction. Most commonly in the age groups we're talking about, that is related to obesity, but can also be related to some upper airway anatomy. Most commonly, the symptoms of this would be loud snoring and also unrefreshing sleep. So some of our athletes, particularly ones who have certain body types like a high BMI or large neck circumference, classically associated with either football or rugby players, might be at increased risk for sleep apnea. There are also some disorders in the central nervous system that can cause excessive sleepiness, or what we call hypersomnia. The most common or the most well-known of these is narcolepsy, which is a disorder of excessive daytime sleepiness and abnormal REM sleep. And while an uncommon disease overall, if you have a history of traumatic brain injury, you're 10 times more likely to have narcolepsy in your lifetime. So a history of sports-related concussion might be an important risk factor here. And I'd be remiss if I didn't sort of touch on post-concussive symptoms, which obviously is a huge topic. There are a ton of sleep symptoms that have been described post-concussion, but important to know that the presence of sleep symptoms may be suggestive of that athlete being at increased risk for protracted recovery. So when we talk about sleep timing, we talk about our circadian rhythm. Circadian factors are biologic functions that are controlled by our body's natural clock, and some of these include sleepiness, alertness, and performance. So when you have disruptions to your circadian rhythm, you can have sleep problems resulting from that. The most common sleep problem that we see related to circadian rhythm is actually a very naturally occurring phase delay that occurs around the time of puberty and adolescence. So instead of that child who can easily fall asleep at 9 p.m. and easily wake up at 6 or 7 p.m., 6 or 7 a.m., everything shifts by an hour or two. So now the tendency is to stay up a little closer to midnight and maybe to sleep a little closer to 10 a.m. And this is sort of a very well-known, well-documented biologic phenomenon that can really have impact on sports that have early morning practices, so swimming, crew, ice hockey, where these teens are really going to struggle to wake up for those that set time. I Jet lag is a travel-related phenomenon when you cross time zones. So we see that for teams that travel, particularly East Coast teams going to the West Coast, where they might have some disruption due to that. And then there's this phenomenon called social jet lag, also very, very common in our teenagers, where they try to sort of make up on the weekend for everything they missed out during the week. Have a very inconsistent weekday schedules, and then come Sunday morning, they kind of like to sleep to catch up on all the sleep they didn't get during the week, and then it makes it much harder to fall asleep on Sunday nights. But I wanted to talk a bit about some strategies to help us improve sleep among everyone, but including our athletes. So I think sleep education is a really big piece, just letting people know that they do need sleep. And so often people think that that's an area they can carve away from their 24-hour period to create some more space, and that's not necessarily what we want to be encouraging. We want to look at what we call sleep hygiene, or behaviors around sleep. So measures like keeping a consistent schedule, having a bedtime routine. A snack before bed is okay, as long as it's more like a carbohydrate or protein-based snack. Anything you get to be sort of too fatty or greasy can sort of interfere with the quality of your sleep. We want an environment conducive to sleep. We talked a bit about exercise already. Light exposure, daylight, sunlight exposure during the day is excellent, but you really want to keep light exposure at night to a minimum, particularly when it comes to electronics and screens. Excuse me, this is probably the most modifiable risk factor that we have in our teens and young adults is the excessive use of screen time too close to bedtime. Obviously avoiding, or at least limiting, caffeine, alcohol, and nicotine too close to bedtime. We're going to talk a bit about increasing the amount of sleep on the next slide. But scheduling changes, we talked about maybe some of the practice times, the exercise too late at night, be mindful of travel, and then really thinking more globally, are there some things that we can move to the off season, particularly in terms of academics or big projects that, when we maybe have a little bit more time, and then treating any comorbid sleep disorders, cognitive behavioral therapy for insomnia, treatment of OSA with surgery or CPAP. But I want to talk a little bit about sleeping more, what happens if you do sleep more, and we've looked at this and we've shown it does help. So in Stanford University, they took a group of scholar athletes who were basketball players, and they tried to reduce the sleep debt to zero by sleeping 10 hours for 5 to 7 weeks, and they ended up doing that. They slept almost 2 more hours per night compared to their regular baseline sleep schedule, and everything really improved. They were faster, they got more baskets, they were much less fatigued, and they felt much more energetic. Similarly, they looked at some tennis players at Whitman College in Washington. They reduced sleep debt by recommending a daily total of 9 hours of sleep, so that included naps, only for a short period of time, a week. And those kids were sleeping over an hour and a half more a night in that week, and they were feeling much less sleepy, and their tennis serves were shown to be more accurate. There's a concept called sleep banking, and this is sort of a newer concept that we'll probably hear more about, but it's the idea of trying to sleep extra leading up to an anticipated sleep loss. So they took 12 healthy men, they split them into a group that either slept their regular amounts or slept for 6 more nights, close to 10 hours of sleep before they wouldn't let them sleep for an entire night. And they found those that had sort of banked those extra hours had improved motor performance, which appeared to be related to having a lower perceived exertion in that group that had the sleep extension. And then lastly, I just wanted to mention napping. There's always been the thought that napping is maybe hurtful to nighttime sleep by interfering with your sort of sleep drive to go to sleep after an afternoon nap. But recently, they looked at almost 300 college athletes, 72% who identified themselves as being nappers, and they actually did not find that napping during the day affected sleep quality or sleep duration. So that was that is something that we can potentially use to encourage our kids to get a little bit more sleep. And I think that we will end there. And of course, any questions would be happy for. Thank you.